All right, so today we're going to take a deep dive into something pretty interesting.
Yeah.
These blue-violet light filtering glasses.
Mm-hmm.
You know, we're just always being told,
Right.
protect your eyes from screens, protect your eyes from sunlight.
Yeah.
But what if these glasses could actually do more
Right.
than just protect your hand? What if they could actually improve vision for people with certain eye conditions?
Well, it's a fascinating area of research, and there is some promising evidence
Okay.
to suggest that that's possible.
Interesting.
Yeah. We've been consulting with Professor Dr. Suhail Sarwar.
Okay.
He's an eye surgeon in Lahore, Pakistan.
Okay.
And he's been using a special type of blue-violet
Interesting.
filtering glasses with his patients.
Mm-hmm.
And the anecdotal reports are pretty encouraging. People are saying they're seeing better.
So we're talking about people who already have vision problems.
Exactly.
Not just people trying to prevent them.
Yeah, we're talking about conditions like age-related macular degeneration or AMD and retinitis pigmentosa, or RP.
Okay.
These conditions often cause what's called a scotoma, which is basically a blind spot.
Right, a blind spot in your vision.
Exactly.
And just to be clear, AMD and RP are pretty different, right?
Yes, very different.
One affects the center of your vision and the other the periphery.
You got it. AMD primarily impacts the macula, which is responsible for that sharp central vision we need for things like reading, recognizing faces. RP, on the other hand, affects the rods and cones in the retina, which are responsible for our peripheral and night vision.
So two very different conditions, both causing these blind spots.
Yeah.
And Professor Sarwar is seeing improvements in both groups with these special glasses.
That's right. And his observations are actually backed up by a really interesting clinical trial.
Okay.
That was published in 2017.
Okay.
They looked at 60 patients, half with central scotoma and half with peripheral scotoma.
So a decent mix of folks. What exactly did they do in this trial?
Well, they put the patients through a series of vision tests, both with and without the blue-violet filtering glasses. They measure their visual acuity.
Right.
That's how clearly you can see their contrast sensitivity, the ability to distinguish subtle differences in shades, and their tolerance to glare.
So pretty standard eye tests. What happened when they put on the glasses?
Here's where it gets interesting.
Oh, wait.
All the test scores improved.
Oh, wow.
For example, their average visual acuity increased.
Okay, that's promising, but was it like a dramatic improvement?
Let's look at contrast sensitivity, for instance.
Okay.
They used a test where you identify letters of varying shades. Patients with central scotoma went from identifying an average of 26.7 letters to 30.06 letters while wearing the glasses.
Okay.
And for those with peripheral scotoma, the average increased from 31.5 to 33.72 letters.
A few more letters might not sound like much, but for someone struggling to read or see details, that could be huge.
Exactly. And remember, this was just one of the tests.
Right.
They saw similar improvements in visual acuity and glare tolerance.
Wow.
And perhaps even more interesting, the blue-violet filtering glasses actually outperformed the traditional yellow-tinted lenses on all the tests.
Wow. So they're not just helpful, they're actually better than what's already out there. Why do you think that is?
Well, we know that blue-violet light carries the highest energy in the visible light spectrum.
Right.
And because of that high energy, it tends to scatter more.
Okay.
Which creates that hazy effect we perceive as glare.
So it's like those high-energy blue-violet light waves are bouncing around in our eyes, causing visual disruptions.
Precisely. The researchers believe that by filtering out this specific part of the light spectrum, these glasses reduce glare and allow the remaining photoreceptor cells in the eye to function more effectively.
That makes sense.
Yeah.
And you'd think filtering out a color would mess with how you see things.
Yeah.
But you're saying they didn't report any color distortion with the blue-violet lenses.
Yeah, that's what's so remarkable. People who wear yellow-tinted lenses often complain about color distortion.
Right.
But that wasn't an issue with these blue-violet filtering glasses.
Okay, this is all sounding pretty great so far, but I know there's always more to the story.
Right.
Are there any downsides or limitations we should be aware of?
You're right. It's important to be cautious.
Yeah.
While these results are exciting, it's important to be aware of the study's limitations.
Okay.
We'll dive into those next.
Great. Let's unpack those limitations and see where this research leads us. So we're talking about some pretty impressive improvements for folks who are already dealing with these blind spots. But what about prevention? Could these glasses help protect our eyes and maybe even prevent conditions like AMD from developing in the first place?
That's the million-dollar question, isn't it? The research on that is still ongoing, but there's definitely a growing body of evidence that suggests it's a real possibility.
Okay, walk me through the logic here. How could simply filtering out blue-violet light actually prevent eye disease?
Well, remember how we talked about blue-violet light having the highest energy in the visible spectrum? We know that overexposure to any kind of high-energy radiation, whether it's UV rays from the sun or X-rays in a medical setting, can cause damage to living tissues.
Right, but we're not talking about X-rays here. We're talking about the light coming from our computers and phones.
Yeah.
Is that really enough to cause damage to our eyes?
That's what researchers are trying to figure out. Some studies have shown a link between prolonged exposure to blue light and an increased risk of developing AMD. The thinking is that this constant bombardment of high-energy blue-violet light, especially over many years, might contribute to the gradual deterioration of those sensitive photoreceptor cells in the macula.
So it's like a slow burn, kind of like how sun damage accumulates over time and can lead to skin cancer later in life.
That's a good analogy. And if that's the case, then it stands to reason that reducing our exposure to blue-violet light, especially from artificial sources like digital screens, could help protect our eyes and potentially lower our risk of developing AMD down the road.
That would be incredible.
Yeah.
Imagine if something as simple as wearing these glasses could actually help us preserve our vision as we age.
It's certainly a compelling idea, but we need more research to confirm whether it's truly effective. Long-term studies are needed to see if people who regularly wear blue-violet filtering glasses actually have a lower incidence of AMD compared to those who don't.
I'd be curious to see what those studies show. But even if it turns out that these glasses aren't a magic bullet for preventing AMD, it still seems like a good idea to be mindful of our exposure to blue-violet light in general.
Absolutely. We live in a world that's saturated with digital devices, so it's more important than ever to be proactive about protecting our eyes. And that goes beyond just AMD. There's some evidence that blue-violet light might also play a role in other eye conditions like cataracts and even contribute to eye strain and fatigue.
So what can we do to minimize our exposure? Besides wearing these special glasses, are there other practical steps we can take?
One of the simplest things is to reduce our screen time, especially in the evening. I know that's easier said than done in our hyper-connected world, but even small changes can make a difference.
Like what? Give us some concrete examples.
Well, try dimming the brightness on your devices, use the night mode settings that shift the screen color to warmer tones, and make a conscious effort to take regular breaks from screens throughout the day. Give your eyes a chance to rest and recover.
Okay, those are all doable. And what about our indoor lighting? Does that play a role in blue-violet light exposure?
It can actually. Traditional incandescent light bulbs emit very little blue light, but many of the newer energy-efficient options like LED bulbs emit a higher proportion of blue light.
So we should be paying attention to the type of light bulbs we're using in our homes.
Exactly. Look for bulbs with a lower color temperature, which means they emit a warmer, more yellowish light rather than a cool bluish light. It can make a difference especially in the evenings when you're trying to wind down.
This is all great advice. And it's never too early to start thinking about eye health.
Right? Absolutely. Even if you have perfect vision now, taking steps to protect your eyes can pay off in the long run. It's about being proactive and making healthy choices that support your overall well-being.
Well, this has been an eye-opening conversation, no pun intended. I feel like I've learned so much about a topic I knew very little about before. But we're not done yet, are we?
Not quite. Let's take a closer look at the actual research itself and unpack the methodology behind those promising results. There are some fascinating nuances there that are worth exploring.
All right, let's dive into the nitty-gritty of the research and see what else we can uncover. Okay, so we've talked about the potential benefits of these blue-violet filtering glasses, both for improving vision and potentially preventing eye disease. Let's shift gears a bit and talk about the research itself. I'm always curious about how these studies are actually designed and conducted. What were some of the key details of the clinical trial we've been discussing?
Well, one of the things that impressed me about this study was the patient selection. They had a good mix of participants, 30 with central scotoma primarily due to AMD, and another 30 with peripheral scotoma, mostly from RP. This allowed the researchers to see if the glasses were effective for different types of vision loss.
That makes sense. It wouldn't be very helpful if they only tested the glasses on one specific type of patient. So what kind of tests did they actually do?
They used a battery of standard vision tests, measuring visual acuity, contrast sensitivity, and glare tolerance. They measured each person's performance, both with and without the blue-violet filtering glasses. And importantly, they also tested some of the patients with yellow-tinted lenses, which is the more traditional approach for dealing with glare.
So they had a good control group to compare against. And If I remember correctly, the blue-violet filtering glasses actually outperformed the yellow lenses on all the tests.
That's right, and that's a pretty significant finding. It suggests that selectively filtering out blue-violet light might be a more effective strategy for improving vision, at least for these particular patient populations.
But of course, no study's perfect. Were there any limitations or things that might make us question the results?
Well, the sample size was relatively small, only 60 patients in total, so it would be great to see these findings replicated in larger, more diverse groups of people.
I see. So we need more data to be really confident about the results. What else?
The other main limitation is that the study only followed the patients for a short period of time, so we don't know if these benefits would persist over months or years of wearing the glasses.
That's an important point. We need longer-term studies to really understand the long-term effects and potential risks.
Exactly. And it's worth noting that this particular study focused specifically on people who already had scotomas. We need more research to know if these glasses would be beneficial for people with other eye conditions, or even for people with healthy vision who just want to protect their eyes.
So there's still a lot of unknowns, but the initial results are certainly promising. It sounds like this could be a real game changer for people struggling with vision loss, and even if the preventative benefits aren't fully proven, yet being mindful of our blue-violet light exposure seems like a smart move for everyone.
I agree, and it's important to remember that knowledge is power when it comes to our health. The more we understand about how light affects our eyes, the better equipped we are to make informed decisions about how to protect our vision. Talk to your eye care professional, ask questions, and stay curious. After all, we only get one pair of eyes.
Well said. That's a great reminder for all of us. Thanks for taking this deep dive with me. It's been fascinating.
My pleasure. Until next time, keep those eyes healthy.